Why do you believe it's important for physicians to get involved with clinical research?
I think it makes us better physicians. It allows us to know what's coming, it allows us to educate, and it allows us to participate and contribute to the medical community.
Now, you have a particular interest in getting greater involvement from patients in minority communities in clinical research. I mean, can you tell us a bit more about that work?
Yes, Hispanics and African Americans are very underrepresented in clinical research. Hispanics represent 16% of the US population, but only 1% participate in clinical trials. And then African Americans represent 12% of the population, and only 5% participate in clinical trials. Here in the United States, we have such a diverse population that it is now critical and crucial for us to understand the way medicine works. Drugs, 99% of the time, work exactly the same for everyone. But now we are getting so much better at medicine that we are now able to provide direct care and personalized medicine. And now this personalized medicine is what's changing the way medicine and research is growing. What we want to do at Emerson Clinical Research Institute is provide those individuals that are normally not represented, now giving them a voice, if you so, to be in clinical research studies.
So what are the barriers to getting physicians involved who can bring patients from minority communities and patients themselves?
So one of the barriers that we are faced with in our settings for research, because we are looking to the community clinics, is that community clinicians do just that. They conduct medicine at the community level. Some of the experience in clinical research for these community clinicians is not as high as those clinicians at the medical centers at the university institutions. And the barrier is that some of the sponsors may believe that just because a physician is conducting regular practice, they may not have the clinical research skills to conduct a study. But that is why I partner with them. That's why I'm a part of their clinics. That's why we are working together one-on-one to provide that needed service.
And patients? What about patients getting involved?
I think some of the barriers that we confront with patients is really scheduling at times. Some of our patients are lower economic status, and their work schedules are not the routine 9-to-5 jobs, or they don't have sick leave, so they can't come to the clinic.
And how do you get around that?
We open on weekends. We're open at night. We make sure we follow up with them and give them everything that they need so that they can come up and do the follow-up physicals.
Now, obviously, there's the whole benefit of furthering medicine and clinical research by being involved in trials in clinical research. But are there any other benefits to physicians and patients as well?
So physicians continue their education. Physicians become a hub of knowledge in their communities. Physicians become better known for not just practicing regular medicine, but providing other alternatives to current medicine. They give other opportunities. They educate at a different level. So the community benefits by that, the physician benefits by that, and then the clinic staff also benefits. Because now that nurse practitioner, that nurse, the medical assistant, the front desk staff personnel knows that there's something different and new and exciting when it comes to treating their patients that they know before their other colleagues know about, because their other colleagues, other nurses, aren't involved in this kind of work. So they have a little bit of a leg up.
Yep.
They learn more, and it makes them a better practitioner.
And then patients?
Patients get more one-on-one attention. We have in the US a survey that's conducted that patients need to complete at times from institutions, from hospitals or major clinics, that says, how was your experience? And based on these grading scores, sometimes there is additional compensation back to the clinic. In the study that was done, it indicated that patients that participated in clinical research referred to their experience as excellent or good, which is outstanding. because they had that extra one-on-one. We follow them. We also tell them what is needed to be a good patient. We make them more compliant. We teach them to be more compliant. Take your medications at this time. Did you take it? Why didn't you take it? Did you get your labs? Why didn't you do it? Did you do your diary to keep track of this? Why not? And the long-term outcome is that their comorbidities also go down. So the clinic also benefits because their patients are also healthier because of clinical research.
So do you have any examples of patients that have benefited directly from being involved in clinical research?
Yes, I do. I have a patient that I used to see that had a traumatic brain injury, and the medications that we were giving him were really causing some issues in his temperature, body core temperature. Fortunately, we put him on our new study medication, which was designed to prevent epilepsy. And number one, he didn't develop epilepsy as we were expecting. And number two, the side effects that were seen in the other drug that was normally given for these traumatic brain injury patients, he didn't have those side effects because he was a new study drug that we were looking at. And it was much better for his total outcome, in my opinion. I also talked to his mother and his father, and I was able to educate them as to what to look for. And I would call them and check on their son. In fact, there were a few occasions where she was concerned and wasn't able to reach the neurologist that was following the patient. Since I called her, I was able to talk to our study investigator, who is a neurologist as well, and we gave her an answer that made her more comfortable. And if I hadn't talked to her about what was going on, if she hadn't been involved in this clinical research study, no one would have talked to her.
One final message then to all the physicians listening.
We have a motto, which is, the future of medicine starts with you. All my physician friends need to understand what the future of medicine starts with you is. And it's a triad. It's you, the physician, of course, you, the sponsors, and you, the patient and their family members. It's that team of those three individuals. If those three individuals aren't present, we're not going to have a future in medicine. So it's up to us as physicians to be a part of this team, to educate and help grow medicine into the next era. If we as physicians, as healthcare providers, don't tell our patients what other options are available, who else will?
Dr. Fabian Sandoval, thank you very much.
Thank you. It was my pleasure.